think patients notice the communication and appreciate that. They also notice the decrease in the cycle time, and they really appreciate that. It's really rewarding, especially if your practice wasn't running great, and patients historically have waited long periods of time, to hear their excitement about how quickly you're coming in and how efficiently you're getting through the day. Still doing the same work and even more, but doing it in a more efficient manner. It's rewarding to see patients excited about the changes that we're making. The influence of doing things differently in our practice has been amazing. I think I didn't even realize how stressful it was not to run smoothly. Not only stressful for myself, but stressful for my team, stressful for patients who are sick and waiting. And it doesn't matter your intentions of trying to serve patients at a very high level that's honoring to them. If you can't do it in the end in an efficient way, it isn't honoring to their time. It isn't honoring to them as patients who deserve to get the highest level of care. So personally, it has brought a lot of joy back to practicing medicine. I've always had joy. I love what I do, but to be able to do it much more efficiently has been extremely rewarding, and I'm very thankful for it.
In thinking about providers who are just starting this work, the best advice that I can give is any change feels uncomfortable. Any change that we do initially feels uncomfortable. I was probably one of the biggest skeptics when this process started. And so just try it. Just give up a little control, try it, and make your decisions after you've tried it, because some of these things are very different. They're innovative in the way that we're taking care of patients. And that will feel a little bit uncomfortable at first. It may even involve extra work at first. It's not unlikely that it will feel harder initially as we set up and hardwire these new ways of taking care of patients. But once that happens, once these changes are hardwired, it really makes everything go more smoothly. I would want to share to other providers who are starting this work would be to just really clarify how skeptical I was when this work started. I'm always open to change, and I'm open to trying new things, but that doesn't mean I'm not skeptical about the likelihood of success in trying those new things. So on my very first phone call with the DPI team, the words that came out of my mouth were, to be honest, I'm very skeptical about a non-clinician telling me how to see patients. And so there was a little bit of ego in that, but there was also this feeling of, more efficiency and more patients isn't always better, because I don't want to crunch the time that I'm spending with patients. I want to be thorough. I want to hear their concerns. I don't want to feel rushed with these patients that I've developed relationships with. And the turning point for me, and the thing that would have made it even easier had I known beforehand, was understanding that through this process, I actually got to spend more time with patients because all of the other waste was cut out. When we look at our old model, much of the waste in a patient visit didn't involve me being in the room at all. So it was getting rid of those other inefficiencies in a patient visit that makes the day go.